Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient is treated for low back pain with unilateral lower extremity radiculopathy. The MRI report indicates the patient's condition is caused by a moderate L3 disc herniation. Which of the following special tests would be most likely to recreate the patient's symptoms? Option 1, straight leg raise test. Option 2, prone knee bending test. Option 3, slump test. Option 4, cross straight leg raise test. Neurodynamic mobility. There are several tests of neurodynamic mobility that can be used to assess the sensitivity of the nervous system to mechanical stress. These tests include the straight leg raise test, prone knee bending test, slump test, and cross straight leg raise test. This particular question requires knowledge of which of the tests target the L3 nerve root. Let's explore each of the options. Option 1, straight leg raise test. The straight leg raise test is performed with the patient in supine. The therapist flexes the patient's hip while maintaining the extension and then adds dorsiflexion or cervical flexion to elicit symptoms. This test places tension on the sciatic nerve and therefore targets the lower lumbar and upper sacral nerve roots, that is to say, L4 to S2. L4 to S2 is not L3. Option 2, prone knee bending test. The prone knee bending test is performed with the patient in prone. The therapist flexes the patient's knee to elicit symptoms. Unlike the other options that affect the sciatic nerve, this test places tension on the femoral nerve and therefore targets the upper lumbar nerve roots, that is to say, L2 to L4. L2 to L4 includes L3. Option 3, slump test. The slump test is performed with the patient in sitting. The patient slumps into a position of lumbar and thoracic flexion and then brings their chin toward their chest. The therapist then passively moves the patient's knee into extension and ankle into dorsiflexion to elicit symptoms. This test places tension on the sciatic nerve and therefore targets the lower lumbar and upper sacral nerve roots, that is to say, L4 to S2. L4 to S2 is not L3. Option 4, cross straight leg raise test. The cross straight leg raise test is similar to the straight leg raise test, except it's performed on the unaffected extremity. If performing the maneuver on the unaffected extremity causes symptoms in the affected extremity, it indicates that a large disc protrusion is likely present. This test would still target the lower lumbar and upper sacral nerve roots, that is to say, L4 to S2. L4 to S2 is not L3. The correct answer is option 2. Let's explore the all-student data. 20% of students selected option 1, straight leg raise test. 55% of students selected option 2, prone knee bending test, the correct response. 15% of students selected option 3, slump test. 10% of students selected option 4, cross straight leg raise test. System classification. This question is a musculoskeletal system question which represents approximately 27% of all exam items. Content outline classification. This question is a physical therapy examination question which represents approximately 24% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out page 256 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.